Yeah, so here in our clinic, because we're not part of a large hospital system, I'm not told that I only have 10 or 15 minutes per patient. We literally devote a full 30-minute slot of time for each new patient. And I do my best to really spend some time first understanding what the patient's complaints are and how that may be impacting their quality of life, and then discussing treatment options with them. And so I really do try to double down on spending enough time with patients so that they leave that initial visit having a pretty good clue about what's happening and what they might be able to do about it. In terms of determining whether an individual patient is ready for a hip or knee replacement, it's highly individualized, and really it's ultimately mostly the patient's choice. My job is to give them the information that they need so they make the right decision for themselves. But really, the decision to proceed with hip or knee replacement surgery is largely about quality of life. And that is, again, defined by the individual patient. I'm still old school. I'm still old school in the sense we spend the time with the patient, whatever's required, to get them to the point where they're happy, they're comfortable, they've had all their questions answered. So first off, we're not going to a hospital. That's largely a thing of the past. We're going to a specialized surgical facility where they're going to be in and out same day. And we've developed an entire protocol, pre-op, intra-op, post-op, that is really pretty finely tuned to help the patient get through that process as easily as possible. We have a dedicated pre-operative session, primarily with my physician assistant, Allison, about 2 weeks before surgery, where she goes through all the key things with the patient, really tries to educate them. We want the patients to know exactly what's going to happen. We want to be on the same page with them. We want no surprises. Part of what we accomplish with all that too is that everything that needs to be done, simple things like filling prescriptions, getting a walker or a cane, is done well in advance. So we're totally dialed in. We do everything humanly possible to take our patients to the point where they are totally dialed in. And so day of surgery, all I worry about is doing surgery, and all they worry about is just recovering. And all that other stuff's taken care of. We've dialed it in. We're on the same page. For those of us who still want to make no compromises whatsoever in caring for our patients, we've got to find direct care models and get out of this horrible mess that we're in with the insurance system. I was very happy to meet David and Matthew at Veritas Surgical and learn more about their system and to be asked to be involved. I had been kind of dabbling with direct care, patients just selecting the doctor, total transparency in pricing, and being able to give them the tools and the resources and the time to treat patients the way they really should be treated. And when Veritas came along in my own professional life, that gave me another way, another avenue, another mechanism by which I thought we could get back to treating patients properly and thoroughly and carefully and really to treat patients the way that they deserve to be treated.